Hi, my name is Danielle Hausman. I'm an occupational therapist and rehab educator here at the Craig H. Nielsen Rehabilitation Hospital. Thank you so much for taking the time to watch this video about skin problems after spinal cord injury. Please take a moment to pause your device and read this important disclaimer. Thank you. Here are the objectives that we'll address in this video. We want you to understand what skin breakdown is, understand why having a spinal cord injury increases the risk for skin problems, and know how to identify that skin breakdown has begun in its earliest stage before it turns into a more serious problem. So what is skin breakdown? Skin breakdown is localized damage to skin and the layers of underlying tissue. And in this graphic, you can see the different stages of skin breakdown. So stage 1 means that the skin hasn't opened up yet, but there's an area on the skin where blood isn't flowing through. We call this a non-blanching area. Stage 2 means that the skin has opened up. Stage 3 means the wound has gone down to the fatty tissue, and stage 4 means it's gone all the way down to the bone. And here you can see listed common terms that your healthcare team will use when referring to skin breakdown: bed sore, skin sore, pressure injury, decubitus ulcer, and a wound. So why does having a spinal cord injury increase the risk for skin problems? So feelings of discomfort normally act as a warning system, and your brain redirects the body to change positions when you feel uncomfortable. These subconscious movements are enough to redistribute the pressure and the blood flow throughout your body in order to prevent pressure problems. So since these signals aren't happening right now, we need to make sure that you're making a conscious effort to move through measures like pressure, relieving, and turning. So why you should care? Skin problems are very common after having a spinal cord injury. About 80% of people living with a spinal cord injury will develop a pressure sore at some point in their lives, and it's most common during the first year after having a new injury, and again 25 years later. That's one of the most common reasons why people end up coming back to the hospital after they've gone home, and a lot of people admit that they could have prevented their skin problem if they had been more diligent about things like pressure relieving up in their chair and turning in bed. So the most common causes why we see skin problems are number 1, because of pressure, and number 2, because of shearing. And you can probably guess that the most common areas where we see skin problems are bony areas, and particularly bony areas that are under a lot of pressure. So specifically your low back and your sitting bones. But we also want to keep a really close eye on all of those bony areas, such as your shoulders, elbows, your tailbone, hips, your butt, your thighs, knees, ankles, toes, heels, and also the back of your head. So what do you think? Take a moment and think about if you think this could be a pressure sore. And if you said yes, you are correct. And what's tricky is that, as you saw in that last picture, new skin breakdown can often just look like a bruise. It can be red, purple, or blue, but the key marker is that it's not blanching. So what you want to do if you notice a new suspicious area on your body is do a simple little push test, or have a helper do a push test for you. And what you want to look for is to see if it's changing colors. So if it does not change colors, we consider that a non-blanching area, and you want to call your doctor right away. And of course, it will look different on different types of skin tones. So on darker skin tones, the blanching might not be as obvious. So what you want to look for is that the suspicious area is darker than the surrounding area, warm or raised. And what's also tricky is that oftentimes pressure sores begin from the inside out. So once we have visible damage on the outside of the skin, it's possible that there's already more substantial damage underneath of the skin that we can't see yet, so we want to take it very seriously. So shear injuries can also be very common, and what shear injuries refer to is when we have 2 layers of tissue that are next to each other that are being pulled in opposite directions. So some common reasons why we see this after spinal cord injury are related to transfer boards. We want to make sure that you're always fully lifting your body and never just dragging it along the board. It also can happen simply if you're sliding down in your bed or sliding down in your wheelchair. Whenever we're helping you to reposition, we want to make sure that we're lifting your body and not dragging it. Another simple reason why this happens is when putting a shoe on, that if your feet are more swollen one day versus another, we don't want to just shove a shoe on because that can cause shearing and you might not be able to feel the pain, so you might not realize that damage is even happening. We also want to be very mindful when we're placing the sling, if you use the Hoyer lift for transfers, and during lower body dressing. And shear injuries can be particularly difficult because it doesn't always leave a mark. It's not as easy to identify as a pressure injury, but once a shear injury has occurred, that part of your body is going to be at increased risk for a pressure injury. So our take-home messages are to avoid pressure for prolonged periods of time, be mindful of any potentially shearing forces and do everything we can to avoid them, take special care over bony areas, and if new skin breakdown is identified, be sure, 1, to notify your healthcare team if you're at home, but also to identify the cause to prevent it from worsening. For example, if it's being caused by a certain position in your wheelchair or by your wheelchair cushion, we want to make a change so that that wound doesn't worsen, and work with your healthcare team to make those changes. As always, please contact your primary care team with any questions that you may have.